Good morning and welcome to
Patients. This is chapter 35 in your text. At the completion of this chapter and all related coursework, you should understand proper body mechanics of patient movement, the principles of safe reaching and pulling, urgent and non-urgent moves, how you can move patients as a team, different types of patient packaging and moving equipment, and how to protect from injury when moving patients, and the use of medical restraints. Under the National EMS Education Standard Competencies, an EMT, at the conclusion of an EMT course for EMS operations, should have appropriate knowledge of operational roles and responsibilities to ensure patient, public, and personnel safety. During the course of any call, EMTs move patients several times to provide medical care in the field and transport the patients to the emergency department. In order to do this, you will need to learn the proper techniques. Many times you will have to move the patient into a different position or location. Once you have assessed the patient and provided initial emergency care, you and your team may have to move the patient onto a long backboard or stretcher. Then you must move the patient to the waiting ambulance and load the patient into the patient compartment. After you arrive at the hospital, you must unload the patient, move him or her to the correct exam room, transfer the patient from the stretcher to the emergency department bed without injury. In order to move patients, as I said, you need to learn proper techniques. It's important we do this early in EMT class because the rest of the summer you're going to spend your time moving patients. Knowledge of correct body mechanics, grips, and devices are very important. When you move a patient, take care that injury does not occur to you, your team, or to your patient. Many EMTs are injured in the process of lifting and moving patients. It takes training and practice to become comfortable with these techniques, and there are special lifting and moving techniques necessary for patients who have head injury, shock, or spinal injury, patients who are pregnant, or patients who are very obese.
Every time you move a patient, keep the following general guidelines in mind.
Do no further harm to the patient. Move the patient only when necessary. Move the patient as little as possible. Move the patient's body as a unit. Use proper lifting and moving techniques to assure your own safety. And have one rescuer give commands when 2 or more people are moving a patient.
Some general guidelines for you to keep in mind during this course. When we lift patients, the shoulder girdle, your shoulders must be aligned over your pelvis. Your hands should be held close to your legs. Force then goes essentially straight down the spine and very little strain occurs. It's important when we lift, we use proper technique. This is the correct way to lift. As an EMT or a paramedic, you may injure your back if you lift with your back curved, in other words, with your spine curved. If you lift with your back straight but bend significantly forward at the hips, your spine needs to be in perfect alignment. This is an incorrect method of lifting, as you can see. You can see they're bending at the hips trying to lift, and they're going to use their arms and not their legs to make this lift. The first lift we're going to learn is the power lift. Your legs should be about 15 inches apart, in other words, shoulder width. You should place your feet so that your center of gravity is properly balanced. With your back held upright, bring your upper body down by bending your legs. You're going to grasp the patient and the stretcher, or the stretcher. You're going to keep your arms the same distance apart as when hanging your arms at each side of your body. Lift your patient by raising your upper body and arms and straightening your legs until you are standing. And you keep the weight you are lifting as close to your body as possible.
When you lift by extending the properly placed flexed legs is the most powerful way to lift. So that's why this is called the power lift. There is a skill drill for this. I will post the proper skill drill PowerPoint for you to review, as well as the skill sheet.
When you are lifting a patient, spread your feet comfortably about shoulder width apart and squat into position by bending the knees. Keep your back straight. Grasp the cot or other object to be lifted with your palms facing up. Keep the arms close to the center of your body. Lift the cot or other object by straightening the knees. The back should remain straight and the arms should remain close to the body.
An example of a power lift. The power grip gets maximum force from the hands. Palms up, hands about 10 inches apart. All fingers are at the same angle and fully support the handle on your curved palm. This is an example of a power grip. If you're going to lift a patient by a sheet or a blanket, and we have new devices that we call mega movers, these are canvas type devices that have handles on them. You want to center the patient on the sheet or blanket or the mover. Tightly roll up the excess fabric on the sides, and then use that cylindrical handle from the roll-up to grasp the fabric and lift the patient. It forms handles. If you're using one of the movers, they generally have handles attached. An example of a move lifting a patient by a sheet or a blanket. Proper weight and distribution. Whenever possible, use a device that can be rolled to move a patient. When a wheeled device is not available, you must use a backboard or other type of moving device. More of the patient's weight rests on the head half of the device than on the foot half. There is a technique called the diamond carry. It uses one EMT at the head and one at the foot of the backboard and one on each side of the torso. In other words, a 4-person lift. There are skill drills for this as well that you will see. This is an example of a diamond carry. Always secure the patient to the backboard or stretcher. This is so the patient cannot slide significantly when the backboard or stretcher may be at an angle. Wheeled ambulance stretchers weigh anywhere from 40 to 145 pounds. Generally, these are too heavy to use on stairs unless it's only a few. And if you must use a backboard or wheel stretcher on stairs, you should follow the steps in Skill Drill 35.4, which I will post for you. A stair chair can be used to bring a conscious patient down to the stretcher. There's a skill drill for this as well. This is an example of a stair chair. A backboard is a device that provides support to patients whom you suspect have hip, pelvic, spinal, or lower extremity injuries. We can use this instead for patients who are in cardiac arrest or who must be moved in supine position or who must be immobilized. Backboards are also called spine boards, trauma boards, or lung boards. It can be placed directly on a stretcher and secured. You don't have to take it out from under your patient. Directions and commands. All actions of the team must be coordinated. The team leader indicates where they want each team member to be to participate in the move. They rapidly describe the sequence of steps to perform before lifting. You use preparatory commands. Some examples of preparatory commands may be the team leader says, all ready to stop, or everybody get ready to stop, to get the team's attention. The team leader says, stop, in a louder voice is another example. Countdowns are often used to lift a patient. Example, on the count of 3. 1, 2, 3. Always clarify if 3 is part of the preparatory command or whether it is to serve as the order to execute. Remember, this is something that if you've ever seen the Lethal Weapon movies, Mel Gibson and Danny Glover used consistently. Do we go on 3 or 1, 2, 3 and then go? But you need to make that very clear when you are utilizing these types of commands. You should always estimate the patient's weight before lifting. Generally speaking, adults often weigh in the range of 120 to 220 pounds. And realistically, 2 EMTs who are in good physical condition should be able to safely lift this type of weight. If the patient weighs more than 250 pounds, you should use 4 rescuers, and it's always a good idea to use 4 if you have them available. You always want your strongest EMT at the head end. The second strongest EMT should be at the foot. The taller person should be at the foot. You should know your weight limitations of your equipment, and special techniques and equipment are available for those patients who weigh over 350 pounds. There are some principles of safe reaching and pulling you should be aware of. When you use a technique called a body drag, which sounds really bad, but it's not, we use the same principles that we apply with lifting and carrying. You want to keep your back locked and straight, you want to kneel, and extend your arms no more than 15 to 20 inches in front of you. If you must drag a patient on the ground or across a bed, you will have to kneel on the ground or onto the bed to minimize the distance that you will have to lean over. Your elbows should extend just beyond your anterior torso, and when you are pulling a patient who is at a different height than you, bend your knees until your hips are just below the height of plane across which you will be pulling the patient. Again, extend your arms 15 to 20 inches in front of your torso. In the hospital, transfer the patient from the stretcher to a bed with a body drag. The stretcher should be at the same height as the bed or slightly higher. You and a partner should kneel on the bed and drag in increments. Another method involves an EMT on each side, just beyond the patient's shoulder and facing the patient's groin. Extend one arm across and in front of your chest and grasp the patient's armpit. Extend your other arm in front and to the side of the torso and grasp the patient's belt. Raise your elbows and flex your arms to pull. The next technique we're going to talk about is the log roll. When you are log rolling a patient onto his or her side, you want to kneel as close to the patient's side as possible. When you lean forward, keep your back straight. Roll the patient without stopping until the patient is resting on their side. Some experts believe you should push rather than pull during a log roll. So where you place your patient, yourself in regards to your patient, is important. And local protocols will guide your training on how to do this. You want to kneel as close to the patient's side, keep your back straight, roll without stopping. Moving a wheeled stretcher. When you're rolling the wheeled ambulance stretcher, make sure it is in the fully elevated position. This is the safe position to roll. Push the stretcher from the head end. If you are guiding the stretcher from the foot, make sure your arms are close to your body. As you walk and guide the stretcher, bend slightly forward at the hips. Never push with your arms fully extended, and if the weight you are pushing is below your waist, push from a kneeling position. Some general considerations that we need to be aware of. Moving a patient, you need to do this in an orderly, planned, and unhurried manner. This will protect you from further injury and will reduce the risk of worsening your patient's condition. At a minimum, you will have to lift and carry the patient to the stretcher, move the patient in the stretcher to the ambulance, and load the stretcher with the patient into the patient compartment. There may be additional steps to place the patient onto a backboard or carry him or her down a flight of stairs. Repositioning will require lowering the backboard to the ground and lifting it again once all EMTs are positioned properly. You need to carefully plan ahead, and you should select the methods that will involve the least amounts of lifting and carrying, and always consider whether there is an option that will cause less strain to you and the other EMTs. Emergency moves. These are used when there is a potential for danger before assessment and management are provided. Some examples would be fire, explosives, hazardous materials, or high water. We use these when we cannot properly assess the patient or provide immediate care because of their location or condition or position and the environment. If you are alone, use a drag to pull the patient along the long axis of their body. Use techniques to help prevent aggravation of patient's spinal injury. You can use the clothes drag by pulling on the patient's clothing in the neck and shoulder area, a blanket drag by placing the patient on a blanket, coat, or other item that can be pulled, or an arm drag, which rotates the patient's arms so they are extended straight on the ground beyond their head. Grasp the wrists and drag the patient. Some examples of emergency moves. You have the clothes drag, upper left as you're looking at the screen, the blanket drag, upper right, the arm drag, lower left, and then the arm-to-arm drag, lower right. If you are removing an unconscious patient from a vehicle by yourself, first move the legs clear of the pedals. Then you will rotate the patient so that his or her back is toward the open car door. Place your arms under the patient's shoulders and through the patient's armpits and to support the patient's head against your body. If the legs and feet clear the car, rapidly drag the patient from the seat to a safe location. If the legs and feet do not clear the car, lower the patient to the ground until the patient is on their back, clear the legs from the vehicle, and drag the patient to a safe location. An example of an emergency move to remove a patient from a vehicle by yourself. Urgent moves may be necessary to move a patient who has an altered level of consciousness, who has inadequate ventilations, or who may be in shock. Rapid extrication techniques should be used when a patient is sitting in a vehicle and must be urgently moved. There is a skill drill for this, and it does require a team of knowledgeable, trained EMTs to perform. The rapid extrication technique is considered an urgency move, and it should only be used if that exists. Some of the reasons this may occur is the vehicle is seen as unsafe, explosives or other hazards may be on the scene, there is a fire or a danger of such a fire, the patient cannot be properly assessed prior to removal from the vehicle, the patient needs immediate intervention that requires a supine position, the patient has a life-threatening condition requiring immediate transport, the patient blocks your access to another seriously injured patient. These are all considerations for the rapid extrication technique. Proper placement of immobilization devices usually requires 6 to 8 minutes. In using rapid extrication, a patient can be moved from sitting in a vehicle to supine on a backboard in a minute or less. The thing to remember is that because of its rapid nature, this technique increases the damage if the patient has a spinal injury and there's no way to fully protect. You need to look at all your available options before you use this urgent move technique. Once the patient has been moved onto the backboard, you need to move them away from the hazard to begin your life-saving treatment. Non-urgent moves. We use these when both the scene and the patient are stable. Again, careful planning is important in proper moving of the patient. The team leader must be sure you have enough people, obstacles are identified and removed, proper equipment is available, and the path followed is easily identified. You need to choose between some of these moves. Direct ground lift, for one. We're going to talk about this first. Skill Drill 35-7. It's used for patients with no suspected spinal injury who are found supine on the ground. We use the direct ground lift when the patient will need to be carried a distance to the stretcher. EMTs stand side by side to lift and carry the patient. Ideally, we should use 3 EMTs, but it can be done with 2. The next move is an extremity lift that we can consider. We also use this for patients with no suspected extremity or spine injury who are supine or sitting. May be helpful when the patient is in a small place or space because it does not require EMTs to stand side by side. You have one EMT at the head, the other at the foot, and you coordinate your movements using direct verbal commands. To transfer a patient from a bed to a stretcher, we use the direct carry. We move a supine patient from the bed to the stretcher using direct carry. This technique is 2 or more rescuers, supine patient moved over. Draw sheet method. With 2 or more rescuers, move the patient from the bed to stretcher using a sheet or blanket. Scoop stretcher. Insert the halves of the scoop stretcher under each side of the patient, fasten them together. With 2 or more rescuers, move a patient to a nearby stretcher. Skill Drill 35-10, which I said will be in the PowerPoints and the skill drill sheets.
Patient carry should only be performed if you are sure that no spine or neck injury has occurred. There are many different types of patient carries.
The pack strap carry. A one-person carry which works best when the patient's armpits rest on your shoulders.
The direct ground lift, which requires lifting from a kneeling position and should be avoided if possible because it strains the lifters' backs.
If the patient is in a chair and cannot assist you, transfer the patient from the chair to a wheelchair if at all possible. Elderly patients. Most of the patients who actually get transported by EMS are considered geriatric or elderly patients over the age of 65. There are skeletal changes that occur, and this causes brittle bones and spinal curvatures. These changes give us some special challenges. Many of these patients cannot lie supine on a backboard without causing further harm. We have to be creative and use proper care in packaging and transporting these patients. We need to consult local protocols. Fear can be an issue for geriatric patients. We need to allay the patient's fears with a sympathetic and compassionate approach. As you can see from these pictures, the patient on the left has severe kyphosis, which is that hunchback, or spondylosis, which is curvature. And they can have kyphospondylosis as well, and kyphoscoliosis. Speak slowly, explain what you are doing, and anticipate any issues. These actions will help you gain the cooperation of your patient. Bariatrics refers to the management, prevention, or control of obesity and allied diseases. Approximately 100 million adults in the United States are overweight or obese. 35% of women older than 19 are considered obese or overweight. 31% of men older than 19 are obese or overweight. Approximately 20 to 25% of children are overweight or obese. The prevalence is greater in some of the minority groups. The management of obesity consumes approximately $100 billion a year in health care. Back injuries account for the largest number of missed days of work for the EMT, so keep this in mind. The larger the patient, the more likely he or she will need emergency treatment and transportation. Stretchers and equipment are being produced with ever higher capacities, and the increasing capacity does not address the danger posed to us by carrying ever heavier weights. Mechanical ambulance lifts are used in Europe, but they are uncommon in the United States, mainly due to their prohibitive cost. Some of the patient moving equipment. Stretchers are available in many models with various features. Some of the general features we're going to talk about include they have specific head ends and specific foot ends. They have a strong metal frame. It's horizontal and rectangular, in which all other parts are attached. The stretcher is pulled, pushed, or lifted by this main frame or handles. Most models have a second tubular frame made up of 3 sections that is attached within or above the main frame. A metal plate is fastened to each of the 3 sections between its sides. This plate serves as the platform on which the stretcher mattress and patient are supported. The head section of the stretcher runs from the head end to the center, near the center, where the patient's hips will be. Hinges at the center allow the head end to be elevated and the patient's back to be positioned at any desired angle. In some models, additional hinges allow the foot end of the stretcher to be elevated as well. A retractable guardrail is attached along the central portion of the main frame. The guardrail can be lowered when a patient is being loaded onto or out of a stretcher. It prevents the patient from rolling off the stretcher. The undercarriage frame allows the litter to be adjusted to any height and locked into place. It can go from 12 inches above the ground for when the stretcher is secured within the ambulance to 32 to 36 inches above the ground when the stretcher is being rolled. The stretcher remains locked at its present height when the controls are not being activated, and the controls are located at the foot end and at one or both sides of most stretchers. The thing to remember is it is important for you to be familiar with all the features of the stretcher you're using before you go on a call.
A cot, also known as a wheeled ambulance stretcher, is the most common device for transporting patients. Cots are available in a number of different models with different features. Be sure to familiarize yourself with the cot you'll be using. Know where the controls are and how each works. The cot has a specific head end and a specific foot end. Use appropriate body substance isolation precautions prior to beginning patient care. To unload the cot from the ambulance, release the locking mechanism for the cot. Begin unloading the cot by lifting and rolling the cot. The second person should guide the undercarriage to the ground and ensure the wheels have locked before completely removing the cot from the ambulance. Once the wheels are locked, lower the cot to the lowest position. With the patient positioned on the cot, gently raise the head of the cot to a position of comfort not to exceed 45 degrees. Place the straps on the patient's chest and thighs and secure. Lifting from the head and foot of the patient, raise the cot to a position 3, 4, or 5. With one person at the foot and another at the head, position the cot to the desired location. Place the wheels onto the platform, lift the cot and release the locking mechanism. Your partner lifts the undercarriage, then roll the cot onto the ambulance and lock it in place. Remember to move the patient's feet first. However, when you encounter inclines and stairs, keep the patient's head up and feet down.
Different types of stretchers. The first is the wheeled ambulance stretcher, also called a stretcher or gurney, or cot. The most commonly used device to move and transport patients is this type of device. Most patients are secured directly to this type of stretcher, although some will need to be secured to a backboard first. Any patient who has a suspected spinal injury or multi-system trauma, or a patient who may need CPR, or a patient who needs to be carried up and down stairs while they are supine. In most cases, it is best to push the head of the stretcher while your partner guides the foot. If the stretcher must be carried, 4 rescuers should be involved, 1 at each corner. If there are 2 rescuers, the 2 EMTs should face each other with 1 at the head and 1 at the foot. A bariatric stretcher is a specialized wheeled stretcher for overweight or obese patients. These stretchers have a wider patient surface area and have a wider wheelbase, allowing for increased stability. Some are equipped with optional features such as a tow package, which allows for an ambulance-mounted winch to assist in loading the patient into the ambulance. The most important feature is the increased weightlifting capacity. Typical stretchers, the normal ones we see in our ambulances, are rated to a maximum weight of 500 to 650 pounds. The bariatric stretcher is rated to hold 850 to 900 pounds. The pneumatic and electronic powered wheeled stretcher is a battery-operated electronic controls to raise and lower the undercarriage. One drawback is that these controls add significant weight to the stretcher. This creates a hazard when transporting on uneven terrain or down 1 or 2 steps. To load a wheeled stretcher into an ambulance, ensure the frame is held firmly between 2 hands so that it does not tip. Newer models are considered self-loading. Extra wheels at the head end allow the stretcher, as you push it into the back of the ambulance, to rest on the floor. Models that are not self-loading need to be lowered and then lifted to the height of the floor of the ambulance. This is a little more difficult. Clamps are in the ambulance to hold the stretcher in place. There is a skill drill application for this. Portable or folding stretchers. This is a stretcher with a strong rectangular tubular metal frame with rigid fabric stretched across it. These do not have a second frame or an adjustable undercarriage. Some models have 2 wheels that make it easier to move the loaded stretcher, and some can be folded in half for storage. Portable stretchers are used in areas that are difficult to reach or when a second patient must be transported on the squad bench. You can also use a backboard. Portable stretchers weigh much less than wheeled stretchers. However, since most models do not have wheels, your team must support all of the patient's weight, the equipment, and the stretcher itself. Flexible stretchers. These can be rolled up across the stretcher's width or length so that the stretcher becomes a smaller tubular package. It's excellent for storage and carrying. They can form around a patient's sides, do not extend beyond them. When extended, useful when removing a patient from or through a confined space. The sked stretcher can be belayed or rappelled by ropes. The flexible stretcher is the most uncomfortable stretcher but provides excellent support and immobilization. A backboard. Long flat boards are made of rigid rectangular material. They used to be made of wood. We've gotten away from wood and gone into these types of plastic or fiberglass. And this is so that it doesn't absorb blood or body fluids. They're used to carry and immobilize patients with suspected spinal injury or other multiple traumas. Commonly, we use these for patients who are found lying down. They're 6 to 7 feet long. They're parallel to the sides and ends of the board. Long holes serve as handles and allow straps to be used to secure your patient. You can see those here. Short boards or half boards are used to immobilize head, torso, and neck of a seated patient with a suspected spine injury, and these are done until the patient can be moved to a long board. Short wooden backboards have mostly been replaced by a vest-type device such as the KED that you see here. And this allows us to immobilize patients sitting down and then move them to a long board. A basket stretcher is a rigid stretcher, also called a Stokes leader. It's used to carry patients across uneven terrain from a remote location that is inaccessible by ambulance or other vehicle. If your patient has suspected spine injury, you put the patient on a backboard first and place the backboard inside the basket stretcher to carry the patient out of the remote location. Basket stretchers are made of plastic with an aluminum frame or have full steel frame that is connected by woven wire mesh. The design allows water to drain through the stretcher, and it's used for technical rope rescues and some water rescues. When you return to the ambulance, you should lift the backboard out of the basket stretcher and place on the wheeled stretcher. A scoop stretcher, also called an orthopedic stretcher, is designed to be split into 2 or 4 pieces. The pieces are fitted around your patient who's lying on the ground or on a flat surface. Then you reconnect the parts and the patient is lifted and put onto a backboard. Both sides of the patient must be accessible for you to use this type of device, and you must fully stabilize and secure the patient while on the scoop stretcher. The next device is called a stair chair. A stair chair is a folding aluminum frame chair with fabric stretched across to form a seat and seat back. Fold-out handles allow you to carry their head and foot ends up and down stairs. Most have rubber wheels in the back so they can be rolled along the floor and make turns. You can also use these wheels to move down the stairs very easily. Neonatal isolettes. A neonatal isolette is also referred to as an incubator. Neonatal patients cannot be transported on a wheeled ambulance stretcher alone. The isolette keeps the neonatal patient warm with moistened air in a clean environment. It protects from noise, drafts, infection, or excess handling, and it can be placed directly on the wheeled ambulance stretcher and secured with seat belts, or be freestanding and secured into the back of an ambulance in place of where the standard stretcher would be. Decontamination. It is essential that you decontaminate all equipment after use. This is for your own safety, for the safety of the crew using the equipment after you, for the safety of your patients, to prevent the spread of disease. All of the reasons we decontaminate. You need to know and follow your local standard operating procedures for disinfecting your equipment. Medical restraints. First, evaluate the patient for correctable causes of combativeness. These include head injury, hypoxia, and hypoglycemia. Follow your local protocols. You need to obtain medical control authorization if that is necessary within your protocol. There may be consequences for either applying the restraints or failing to restrain the patient who should have been restrained. Restraint requires a minimum of 5 people, 1 for each extremity and 1 for the patient's head. One EMT is the team leader, and you should develop a plan to restrain and work together. If the patient is caught off guard, they are less likely to injure responders for the restraint. The patient should be in the supine position. If you place the patient in a prone position, they can develop positional asphyxia and could die. Each extremity should have a restraint applied to it. Preferably, the patient should be restrained on a backboard with one arm above his or her head and the other by his or her side. This limits the patient's ability to move and fight. Assess the patient's circulation after you apply the restraints and document all of the information. Personnel considerations. You should always ask yourself the following questions before you move a patient. Am I physically strong enough to lift and move this patient? Is there adequate room to get the proper stance to lift the patient? Do I need additional personnel for lifting assistance? Remember, if you injure yourself, you cannot help anyone. You are now a patient and a hindrance to the operation of the rescue. In summary, the first key rule of lifting is to always keep your back in an upright position and lift without twisting. You can lift and carry significant weight without injury as long as your back is in the proper upright position. The power lift is the safest and most powerful way to lift. The safety of you, your team, and the patient depends on the use of proper lifting techniques and maintaining a proper hold when lifting or carrying a patient. When moving any type of patient-carrying device, pushing is always better than pulling. If you do not have a proper hold, you will not be able to bear your share of the weight, or you may lose your grasp and possibly cause a lower back injury to one or more EMTs. It is always best to move a patient on a device that can be rolled. However, if a wheeled device is not available, you must understand and follow certain guidelines for carrying a patient on a stretcher. You must constantly coordinate your movements with those of the other team members and make sure that you communicate with them. When lifting a stretcher, you must make sure that you and your team use correct lifting techniques. Ideally, members of the lifting team should also be of similar height and strength. If you must carry a loaded backboard or stretcher up or down stairs or other inclines, be sure the patient is tightly secured to the device to prevent sliding. Be sure to carry the backboard or stretcher foot in first so that the patient's head is elevated higher than the feet. Directions and commands are an important part of safe lifting and carrying. You and your team must anticipate and understand every move and execute it in a coordinated manner. The team leader is responsible for coordinating the moves. You should try to use 4 rescuers whenever you have adequate resources. You should also know how much you can comfortably and safely lift and not attempt to lift more than this amount. Rapidly summon additional help to lift and carry a weight that is greater than your lifting capabilities. The same basic body mechanics apply for safe reaching and pulling as for lifting and carrying. Keep your back locked and straight and avoid twisting. Do not hyperextend your back when reaching overhead. You should normally move a patient with non-urgent moves in an orderly, planned, and unhurried manner, selecting the methods that involve the least amount of lifting and carrying. At times, you may have to use an emergency move to maneuver a patient before providing assessment and care. You should perform an urgent move if a patient has an altered level of consciousness, inadequate ventilation or shock, or in extreme weather conditions. The wheeled ambulance stretcher is the most commonly used device to move and transport patients. Other devices include portable stretchers, flexible stretchers, backboards, basket stretchers, scoop stretchers, and stair chairs. Whenever you are moving a patient, you must take special care so injury does not occur to you, your team, or the patient. You will learn the technical skills of patient packaging and handling through practice and training. Training and practice are required to use all the equipment and that is available to you. You must practice each technique with your team often so that you are able to perform the move quickly, safely, and efficiently. Please take notes during these lectures, as I've said before, and bring questions to class with you. Thank you.